is Dr. Vaibhav Shah, facial cosmetic and plastic surgeon, hair transplant surgeon, Mumbai, India. Well, in this video, we're going to show you how to make your surgery, hair transplant surgery, more and more pain free. Uh, of course, who would like to bear a pain? Okay, so this is just a skull for understanding. Here we have a occipital tuberculins. Okay, you get a superior and inferior mucovines. Once you feel this on a 1.5 centimeter on each side, you get the occipital nerves. Once you block those nerves with the local anesthetic solution, surgery become really painless. That is a one thing what you can do. Secondly, well, that is for the harvesting part. Now I'll be talking on the implanting part. From the midpoint here, which is called as a glabella, 17 millimeter on each side, you will going to get one foramen, which is a supratrochlear foramen. You get the supratrochlear nerves from it, and 27 millimeter from the glabella on both the side you get the supraorbital nerves. These two nerves, basically it is a branch of ophthalmic division of trigeminal nerve, which is the fifth cranial nerve. Basically what I want to say is, once you block these nerves, your implantation procedures really become painless. We all are using local anesthetic solution. We know what are the dosage to be used. Once you block these nerves, like you block the occipital one, you block the supratrochlear, supraorbital, you need to use very less amount of a local anesthesia, less complication, and believe me, the surgery is really painless. One more thing, what one can do is, you can simply use this kind of a device which is called as a local massager or a vibrator. You can attach this to the electric board and you can just start. This produces lot of tremendous vibrations. When you are injecting the local anesthetic solution, if you use this, basically now gets confused and the pain is less. You are actually not causing a less pain, but you are making a now confused, so patient do not feel pain. Third thing what one can do is, these are the insulin syringes. We all know it is just 30 gauge, which is one of the very smallest diameter. Okay, so when you are giving a now blocks, you are injecting specifically on a supraorbital, supratrochlear, you can use this kind of syringes. These are disposable one, really helpful, and believe me, it is so small. It is barely pain anything. Most of the insulin patients, they take insulin injections on their own, so you can imagine how much less kind of a pain you can have. Last but not the least, this is basically a amla, which is also called as a eutectic mixture of lignocaine solution. It is a 2.5% prilocaine and 2.5% lignocaine. Well, it is basically an ointment. Once you get this ointment out, you can apply it wherever you want to inject. It is act as a surface anesthesia. Most important part is, you need to cover that thing with the tegaderm, because it has a property, it can evaporate, so the effect is less. So once you apply it, keep it for 45 minutes. Okay, you can apply tegaderm over it or any cling film you can apply over it. Wait for 45 minutes, use vibrator, use insulin syringes, and give specific nerve blocks like a supratrochlear, supraorbital, occipital. Believe me, the surgery is almost virtually no pain. Um, of course, it is a cosmetic procedure. Not all patient wants to go, but whomsoever wants to go, you make your surgery more painless. Patient is more comfortable, they are more happy, and at the same time, we all are doing cosmetic, or you can say the hair transplant surgery under a local anesthesia. So the more you reduce the pain sensation, it is always better for the patient. Thank you very much. I hope this video is helpful to you. Thanks again.